West Ham midfielder Manuel Lanzini suffered a shoulder injury in a 3-0 loss to Burnley. At first, I thought it was a shoulder dislocation. However, West Ham medical team have confirmed that he does in fact have a broken clavicle. In this video, we're going to look at the mechanism of the injury, the normal anatomy of the affected region, and the potential recovery and treatment news for Lanzini. Before we start, my name is Matthew Faisa and I'm a third year medical student from London. Make sure to subscribe to the channel and check out our other videos, one most recently on Everton midfielder Andre Gomez, who had that horrific ankle injury. Lanzini came on as a sub for West Ham against Burnley and injured his collarbone in the last few moments of the game. He landed awkwardly on his shoulder and appeared to be in a lot of pain. In fact, if we look at this picture, we can see him being stretched off towards the latter stages of the match. This is sad because it occurred in the last few moments and perhaps a few change of events would not have occurred. And secondly, personally for Lanzini himself, he has suffered a couple of injuries in the last few years, so it's sad to see him go back into the medical room once again. This injury has been shared with a few athletes in football, most notably Mo Salah, who got injured in the Champions League final when Sergio Ramos dragged him to the ground, and also in the NFL with wide receiver Tyreek Hill, who suffered this injury a few weeks ago. To understand the injury fully, we're going to look at the anatomy and assess how the breaks actually occur and where they occur. The normal anatomy of this region consists of the clavicle bone, which is in the middle of the sternum, in the middle of the chest, and the shoulder joint, which is on the side. It forms a connection with the sternum, called the sternoclavicular joint in the middle, and also forms part of the joint with the humerus, the thick bone in the upper arm. The sternum itself is rarely injured unless there's direct trauma or force applied to that region. This is because it's quite a secure bone and it's quite thick. In addition to the sternoclavicular joint, it also forms articulations with the ribs 1 to 7. These are known as the true ribs. An injury to the sternoclavicular joint is rare due to its anatomy. However, when it does occur, in Tyreek Hill's case, it typically occurs due to a fall onto an outstretched arm, also known as foosh. Whenever this injury occurs, it's quite bizarre, as sternoclavicular joint dislocations only account for 1% of injuries to that region. Lanzini, on the other hand, had a fracture to the actual clavicle bone shaft. Breaks in this bone are fairly common and occur either due to direct trauma or similarly like Tyreek Hill, or fall onto an outstretched arm. This happens when the arm puts too much pressure on the bone, which is quite a thin bone, and causes it to snap. If we look at these two x-rays, here are two potential ways in which a fracture can present. The first being a displaced fracture, where there is a clean bone and only one break. The second being a comminuted fracture, which produces many different fragments as there's more than one break in the bone. As you can imagine, a displaced fracture is a lot easier to treat and a lot easier to manage, as there's one break and only two fragments. As a result, there's straightforward treatment for this, which we will discuss later in the video. Regarding the symptoms Lanzini would have experienced, or anyone with this injury would have had, pain is obviously one of the main things. Being stretched off on what appears to be oxygen is one of the key signs of this for Lanzini in particular. Secondly, you can also get a bump or lump in the region. This can often feel like a pinch, as sometimes, in the worst cases, bone can actually pinch on the skin. There is risk to this, as something called a vascular necrosis can occur. In the process known as skin tenting, there is a risk that the broken bone and fragments lacerate blood vessels and cut off the supply to the skin. This leads to the death of soft tissue, bones and skin, and would present as kind of a blackened region, as there's no blood supplying that area. A particularly vulnerable vessel is the subclavian artery. There is risk if this is lacerated that it could lead to necrosis. However, there is some protection from the scalenus anterior muscle, which kind of blocks this from occurring. For treatment, there are two ways to approach the Argentine's injury. The non-surgical method, known as the conservative approach, is through physical therapy and allowing the bone to kind of fully form and grow slowly. With this method, you just have to make sure the bone grows in the correct orientation and does not grow out of place. You would do this by having repeated x-rays through the recovery process, which allows you to assess and manage any potential bone complications with growth. Clavicle fractures don't necessarily require surgery. However, with professional sports, they often do want quicker recovery times and they do elect for quite swift treatment. As a result, West Ham medical team might work alongside surgeons and elect for kind of open reduction and internal fixation approach. Internal fixation, much like anywhere else in the body, elects for the use of plates and screws to help realign the bone and keep it fixed in place, in effect ensuring that the bone grows in place and maintains its normal alignment. This is a bit excessive for a first-time fracture of the bone in that region and wouldn't be used for kind of normal patients. However, as Lanzini is a sports athlete, they do have access to this. To my understanding and reading various reports, West Ham have elected to go down that surgical route, and Lanzini has had surgery as of the making of this video. With the typical treatment time as being about 7 to 8 weeks, Lanzini would miss 7 games roughly, and I do suspect he would come back around Christmas time, potentially just after the new year. This is the end of the video now. If you like this style of content, make sure to subscribe to the channel, like it and share with your friends. And also watch our most recent video on Andre Gomez, who had a broken ankle injury playing for Everton. I'd also like to thank Reddit Soccer. They've been helpful enough to leave me a few comments here and both on the threads, and it's helped me improve and introduce me to a new audience, so it's good that it's being received well there. As a result, I hope I can provide more insightful content in the future and continue the good streak that I have going. Apart from that, I want to say thank you for watching and comment down below what other athletes you would like me to cover in the future.
Dynasty program initiating.
Dynasty boy. Yeah. Yeah. I had to get out at end, so hopefully I could focus on music fully. So I went back to uni to find out the distraction of being fresh is triple the amount.